Now we will see about clinical assessment of anxiety disorder and management. Okay, we will start with the clinical assessment. So like in any psychiatric disorder, anxiety also should have these component of assessments. History from multiple informants, including parents and other caregivers involved. A detailed mental state examination where we have to understand their thought, emotions, behavior. Okay, in anxiety, if you see, thought will have lots of worries, content of thought, and speech will be excess in volume because they will be narrating about their experiences related to anxiety. Motor, usually they will be agitated, restless, motor skills. And there will be lots of avoidance. Their behavior, they will describe lots of avoidance. And their higher mental functions will be normal. Sometimes you can see anxious affect during interview. Sometimes the affect may be normal during interview, or you can see anxious affect. Okay. So these are the component of mental state examination, an important finding in evaluation children or adolescents with anxiety disorder. Rating scales, as we discussed before, we can use wherever it's required. Medical examination to rule out other endocrine neurological causes presenting as anxiety disorders as a part of differential diagnosis, and relevant investigations for comorbid condition. For example, if you are suspecting a developmental problem like ADHD along with anxiety, SLD, specific learning disorder along with anxiety, or other psychiatric disorders, then you have to use relevant history, mental state examination finding, and relevant investigations like a cognitive assessment or IQ assessment or specific learning disability assessment, ADHD parent rating scale, and other psychiatric rating scale should be used wherever it is required. So these are the component of clinical assessment of anxiety disorder. So once after the assessment, we should come to this formulation, basically biopsychosocial model, which is very important in the management of anxiety disorder. Okay, so this is a picture, very good picture we have taken from the Google. So if you see the biological factors involved, physical health, any disabilities in the background, genetic predisposition or family history of anxiety, neurochemicals involved, immune response, all these things are considered as a biological factors. All these things cannot be brought out. For example, neurochemical thing cannot be brought out through assessment. Genetic predisposition we can only obtain from family history. Okay, we cannot do any, commonly we are not doing any genetic testing in anxiety disorders. So these are the biological predisposition towards anxiety disorder. Psychological, basically the temperamental, which is basically biologically determined, and this temperamental factors interact with social factors. Biopsychosocial, okay, this is social, okay, this is biological, this is psychological. Biopsychosocial, okay, the temperament, the biological factors interact with social factors, and they will have the psychological factors evolving over time. Okay, their belief system, their behavior, personality, self-esteem, coping skills, emotional regulation, social skills, all these things evolve over the time. All these psychological factors are important in the treatment of anxiety, but basically this is formed over time with the interaction of these two, biological and social factors. Okay, and social factors including drug use, which is biologically also we use drugs for some medical condition, and a substance of addiction. Peer relationship, family environment, cultural tradition can also cause anxiety symptoms. Poor support system can cause lack of education, poverty. All these things are social, whether some of these factors are present. So combination of biological, psychological and social factors lead to adverse mental health outcome. So at the end of the assessment, we should try to establish these factors, which is very important in the management of anxiety disorder. And also we should have information about these 4 P's, okay, predisposing, precipitating, perpetuating and protective factors. Okay, predisposing, basically areas of vulnerability that increases risk of psychopathology. Here biological factors are more important in predisposing factors. Okay, biological and psychological factors are more important in predisposing factors. Basically predisposing factors are factors that increase vulnerability towards development of anxiety disorder. Precipitating, again this is a psychosocial factor, stressors or other contextual events that has a chronological association with symptom onset. Okay, I have a life stressor after which I developed clinical anxiety disorder. Okay, I was having temperament, biological predisposition, anxious traits or behavioral inhibition. After the life stressor, I developed clinical anxiety. Okay, this is precipitating factors that directly precipitate clinical anxiety. Perpetuating factors, any aspect of patient's family or community that serve to perpetuate the symptom, that is the continuing the symptoms. Okay, they prevent the patient from getting out of anxiety. So basically family environment and patient's own personality and temperament that perpetuate the symptoms. And protective, what are the factors that are protective against anxiety? Areas of own strength and support from the family and support from the community. Okay, these 4 P's are important in the management of anxiety disorders. So we will move on to the treatment. So this is a clinical assessment, basically coming to a formulation, biopsychosocial formulation, and finding the factors causing, predisposing and perpetuating and protective factors as well before moving on to the treatment.